We now take a deeper dive into the impacts of the Omicron surge on America's schools and the pathway forward. And we're joined by the Secretary of Education, Dr. Miguel Cardona. Thank you so much for coming on the show tonight.
Thank you for having me.
As Secretary, you, of course, have been urging schools to remain open. But in Chicago today, as we've reported, the city closed school for the day. What's your reaction to the vote by the Chicago Teachers Union to go remote? And are you worried that other unions could follow suit?
You know, it's disappointing and frustrating. Our students have suffered enough across the country, and we have better tools now to keep our schools safe, including mitigation strategies that we know work. They worked before we had vaccines, and I believe we can keep our students safe if we use our mitigation strategies, increase the number of students that have vaccines, and continue to work together to make sure we're keeping our students at the center of the conversations, especially when it comes to in-person learning.
And the nearly $2 trillion COVID relief plan included billions of dollars to support schools nationwide, including money earmarked for upgrades in ventilation and COVID testing. How much of those funds have schools actually used to safely keep their doors open, and for what?
Yes, it has. And, $130 billion to safely reopen schools is the reason why, and with the hard work of educators across the country, we went from 47% of our schools fully open when the president took office to 99% in December. We know that it took improved ventilation systems. We know the money was used for robust summer learning programs for students who maybe the last year, a year before that, haven't been around their peers. And just as important, additional social workers, because our students are coming back from tremendous trauma. We know that 140,000 students lost a parent or caregiver. So the American Rescue Plan funds were also used to provide better social emotional support and access to mental health supports.
Do you think that more money is needed from the federal government for schools at this point?
I believe we have the tools that we need to safely reopen our schools. Additional vaccines are available now for children ages 5 and up. We have testing. We have robust surveillance testing programs in place that, in addition to the vaccines, to the mitigation strategies, can allow our students to be safe in the classrooms and allow them to learn in person, where we know they learn best.
And while the vaccines are available, as you said, as you know, more than 30 million eligible school-age children are still completely unvaccinated. Do you think that school districts should require vaccinations at this point, particularly with this alarming rise in pediatric hospitalizations?
Those decisions really are state and local decisions, but let's look at the data. We know that in those states that were slow to increase student vaccinations, we saw more student hospitalization. But I point to states like Vermont that got over 60% of their students above the age of 5 vaccinated. They're going to rely less on tests because they know that if a student does contract COVID-19, there's a shorter quarantine period and they can return to school. So it really does require us coming together, making sure we're still leaning on science, because we know that that's what got us to this point, to have 99% of our schools open. And we need to continue to vaccinate our students and lean on our health experts to help get us through this.
And we've certainly done a lot of reporting on the harm of remote learning, from learning loss to the rise in mental health and behavioral issues, to some kids actually getting lost in the system. Looking back to 2020 and early 2021, do you think that school districts, particularly those in blue states, made the wrong decision when they shuttered classrooms? Was the cost simply too great?
Absolutely not. I was a commissioner of education at that time, and a father of 2 students too, and I certainly wouldn't want for any child in the country what I wouldn't want for my own children. At the time, in March 2020, we needed to close schools. We didn't know what we know today. Thankfully, the following school year, we were able to open schools with mitigation strategies, even before the first vaccine was administered. So we know we can do it today, but I don't think the decision to close schools when COVID-19 first hit was extreme. If anything, it protected lives.
And in your opinion, what justifies a school going entirely remote at this point? Where do you draw that line?
Again, since March, funds have been available for districts. But I do want to commend educators, school leaders, district leaders for the heroic work that they're doing to keep our schools open. As I said, 99% of the students in the United States have access to in-person learning today. So we do have the resources. The challenge in some places, what I'm hearing when I talk to administrators, is they might find out hours before school opens that 10% of their staff is not available. It becomes a safety issue, but that's a very rare, and it should be an emergency, not the norm.
And I want to circle back on that learning loss caused by the pandemic. Your department and many of the schools themselves have plans to address this, but could this still have long-term effects for some children?
You know, certainly we're going to be learning about the impacts of the pandemic for years to come. We know that students, not only their academic needs were impacted, but their social and emotional needs were left unmet for the last year and a half. You know, we should think beyond reopening schools. How are we going to reimagine schools to give our kids opportunities that we didn't have before March 2020? They suffered a lot. We should be talking about extended school days, schools as hubs of community where social emotional support, not only for the students, but the families, is available. We need to lead the world in education, and that starts with making sure that our students have access to in-person learning.
So as you said, you have the resources. What about those reservations that remain among parents and teachers and staff who are worried about their own safety going forward as far as those who are going to work on their own and those who are sending their kids off to school?
Right. You know, I'm sensitive to their concerns. I too am a parent. But what I can tell you is effective use of mitigation strategies, ensuring that your children are vaccinated, ensuring that there is access to testing so that if your child is sick, they stay home. You know, these are all strategies that we have now to keep our schools thriving during the pandemic. We cannot wait for this to pass for us to think about reopening schools. You know, the students that are in school right now can't wait. They've suffered enough, and we really have to do what we can now to give them an opportunity to thrive during the pandemic. And we have the tools to do it. We need to have the urgency across the country.
Education Secretary Miguel Cardona, we thank you so much for your time tonight.
All right, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.